Is your diet and or your use of antibiotics that are being prescribed by your doctor, are they causing your hypothyroidism? Let's dig into that. So we all understand how a poor diet can cause upset problems to the gut, right? With stomach upset, or you get a little diarrhea, you get some constipation, temporary things, right? Your body passes on and gets it out of your system. And we understand how that works. It's just not healthy for our gut to deal with those things. But what if we're actually eating things that have toxins in there? For example, would be foods that are non-organic, right? They have pesticides on them. They have literally environmental toxins which damage the gut lining. Well, that can lead to things like leaky gut. The leaky gut, I talked about this on another video, but essentially just think of a leaky gut. There is a layer, like a fence line in your gut lining to protect it. And there's fence line where the fence post comes side by side. They don't allow anything in between them, just like the fence line around your house. But toxins can insert themselves in between those fence posts. And this jagged, kind of funny shaped toxin can insert itself into that fence line. And now when you go out to your fence line, you see that there's a kind of a squiggly, funny looking shaped board between my fence line. And you can see now into my neighbor's house through the cracks. Same thing here. These toxins insert themselves into your gut lining, and next thing you know, you got toxins, things that you have in the gut, like infection that you shouldn't be getting into your bloodstream, That cranks up your immune system, and that overreaction of the immune system to this leaky gut problem leads to hypothyroidism, because your immune system in the overreaction process now attacks your own thyroid. Your thyroid gets caught in the crossfire of this hyperreactive immune system response due to this problem. So that can cause it. The other thing we want to talk about are your antibiotics. So every time you go to get to the doctor and they give you antibiotics, whether it's for an ear infection or a sinus infection, or a sore throat, or you got bloating in the gut, you think you got food poisoning, whatever the case may be, you get a cut and a scratch, and that needs to be healed up with some antibiotics because it starts to get infected. You take antibiotics. Well, what do the antibiotics do? They're going to kill off those bacteria. Yay, great. But they also kill off your good bacteria. You've heard the term probiotics. Antibiotics kill those off. Those probiotics are necessary for you to convert things like T4 to T3. T4 is your inactive thyroid hormone. That has to convert to T3, which is the active thyroid hormone. T4 does you no good unless it converts to T3. And where does that occur? That conversion occurs in 3 places: the liver, the kidneys, and in the gut. You need your probiotics on board, functional, and fully present to convert the T4 to T3. And if you're struggling with hypothyroidism, if you're dealing with the effects of being tired, hard losing weight, feeling cold all the time, mood swings, brain fog, all the things that come with sluggish thyroid, and you have an unhealthy gut, you're going to be taking levothyroxine and Synthroid for the rest of your life. You have to find out, do I have toxins in the gut? Do I have poor probiotics? Does this leaky gut problem stem from the fact that I've been on a lot of antibiotics in my life? Maybe you had Lyme's disease at some point and you were on a month straight of antibiotics, or some people it's 3 months of antibiotics. That kills off a lot of your bacteria, and that really affects your ability to make T3. So in this case, we want to test for that, right? And that's what we do in our office. So it's your lucky day. In the description to this video, you can go to the link there, and that will help you sign up for a call with us. We spend up to 30 minutes with patients answering their questions about this or just functional medicine in general, whether you're wondering how that works here in our office. Happy to answer your questions. We also want to make sure that you are a good fit for our office. And so we ask questions and make sure that you're a good fit. And if you are, great. Then we can start to talk about testing we need to do to figure out if antibiotics have played a role, if toxins are playing a role, because your thyroid will never get fixed until you get to the root cause. All right? Take advantage of this call.